Good morning, everyone, and thank you for joining CalVet's webinar on benefits and resources to aging veterans. Before we begin, I would like to bring to your attention that this webinar is being recorded, and by logging in, you are agreeing to be a part of this recording. We record it because we want to benefit all those that are not able to join today, and they can go onto YouTube and see all of our recorded webinars. My name is Jennifer Redquist, and I'm proud to say I'm a CalTAP training coordinator with the California Department of Veterans Affairs. I am a veteran myself. I'm a military spouse, and I'm the mother of 3 active duty airmen. So I can safely say I've been in all of your shoes. I'm actually a military brat. Also, my dad served. And so I understand the hardships that you guys have all had to endure to ensure our country's freedom. So I want to say a sincere thank you for everything you do and you've done to support the United States military, uniformed or not. I understand that all of you have served, and I want to say thank you. I don't want you to say, and also say that cradle to grave, CalVet, and all the resources and presenters here are truly passionate about getting resources to you. And so we highly encourage you guys to reach out to any and all of us. If you are in any need, or you know anybody in need, or you have any questions, reach out and let us know. All right, this presentation is packed with great information. I'm glad you guys are here. Our presenters include Annette Wallover. She's our local interagency network coordinator in the Central Valley area. We have retired Chief Master Sergeant Paul Limpberg. He is our Yountville Homes VSO. And lastly, we also have Erica Cheney. She is the director for CalVet's Cemeteries in the state of California. Now, one other person that's here with us today is Michael Monk. He is also a CalTAP training coordinator. He is going to be in the chat area and also in the Q&A. He's going to be helping on the back end. So please, we ask that you guys, while this presentation is going, to put all of your questions in the Q&A at the top there. You can wave at the top or the bottom to pop up the Q&A and put your questions there. Now in the chat, you're going to see a bunch of links being put in there by Michael to assist with finding those different benefits and resources you might need. At the end of presentation, we're going to address all of your questions, because probably if you had that question, somebody else did too, and everybody wants to hear what those questions are and to learn from them. All right, let's get started. Sorry, having a little bit of technical issues here. Just trying to get us set up correctly. Next slide. So what is CalTAP? You've heard me say CalTAP a couple times. Just like the military, CalTAP, there's lots of acronyms for things. CalTAP stands for the California Transitions Assistance Program. Now, we were designed to inform and connect veterans of all eras that earned federal and state benefits, as well as provide continuing support and assistance as your needs change over time. So we want to help you guys cradle to grave. And we do this with these webinars, we do this with outreaches, and we do this with our online learning portal. And we have 5 different pathways for that. We have core curriculum, education, employment, entrepreneurship, and service providers. Now, service providers is a is a learning pathway for those that work with veterans to help with culture competency and kind of know, let those service providers what your needs are and how they can help you as best for your needs. Now, this is the CalVet page, the website. We highly recommend, please go to this. It's packed with fantastic information. Everything is a click away. Right now, you're looking at the CalTAP portal, but I want to bring to your attention, go to at the top where it says CalVet programs. It's a drop down menu. So all of the divisions within CalVet are in that drop down. On the main page, when you get there, if you want information about education or housing or home loans, it's all a click away. If you go down towards the bottom of the page, of that home page, you'll see our Calvet resource book. It is like gold, you guys. All of your resources, all your benefits are at your fingertips at all times. This is mine. There's lots of stickies on here, lots of different notes I have on here because all of your federal and state benefits are in here. Download that and share it with as many people as possible. You don't know what you don't know. You don't know how to ask the questions if you don't have the resource, if you don't know what's out there for you. So get one of these resource books, check it out, and then start asking all your questions. Michael is going to be putting all the PDF in the chat for you guys also to download onto your computers. Now, what are the California specific benefits? There's quite a few amazing benefits in the state of California. The first one we have here is college tuition fee waiver. This is going to waive the tuition and fees at any state funded schools for your dependents or for dependents that have a spouse or a parent that is rated by the federal VA of 0 to 100%. There's a few different there's a few different plans within this. I recommend that you go to our website and go to the education part of our portal. Next is veteran designation on your license. This is fantastic. You can get the word veteran put on your driver's license. Why is that cool? That is cool because you no longer have to carry around your DD form 214 to verify you are a veteran. Not only does it have very, very private information like your social security number on there, 9 times out of 10, most of the civilian side, the stores or wherever you're getting your discounts or wherever you need to prove it are not accredited to read those. So they don't even know what you're reading there. So the designation is fantastic. It's only $5 to get that on your license. You're going to go to a county veteran service office with your DD form 214. They're going to verify, yes, indeed, you are a veteran. And they're going to give you a form stamped by this county seal and with a county seal, and you're going to take that to DMV. Motor vehicle registration fee waiver. This is fantastic. It's going to waive the registration and fees of one of your vehicles if you're 100% rated by the federal VA and you have a disability that interferes with your mobility. For instance, you might have a part-time breathing. For instance, you might have knee problems. You might have back problems. Whatever it may be, you can get a license plate that will give you handicap parking and also waive the registration fees of one of your vehicles. If this applies to you think it applies to you or a loved one that is a veteran, please go to a county veteran service office and get that paperwork started. It can save so much money in the state of California. Next thing is fishing and hunting licenses. If you're 50% rated by the federal VA, you can get a reduced fishing and hunting license. And you can also get no cost to state park passes, and that works all over the state. It is a fantastic program. I use it all the time when I go to state parks. Nope, I don't have to pay for parking anymore. Just go right in. The next thing is veteran property tax exemption. You guys, this is a great one. If you are a veteran with 100% rating, or you're the spouse of somebody that is 100% rating, you guys can go to your county assessor's office. That's where you pay your taxes, your home taxes. Tell them that you're 100% rated. Show them your form or your VA letter that says you're 100% rated, and they are going to exempt $150,000 of your property taxes. That's going to be $1,700 a year of savings to you. And every year it automatically renews. It's a fantastic benefit. We also have business licenses, taxes, and fee exemptions for veteran-owned businesses. So please go to your county assessor's office, tell them you're a veteran, show them that license with the designation, show them your letter from the federal VA if you have that, show them your DD form 214 and say, hey, I want to open up a business. What type of incentives or fees can be exempt? Now, right here on the right side, we have all the divisions within Calvet. We have a Calvet Home Loans, which works direct. They work with your federal VA home loan, which is a guarantee. They are non-commission based, and we want to get California veterans in homes. If you're having a hard time getting a home, please give us a call. We have a fantastic women's division and minority division, which is, both these divisions are advocates and outreach to women and minority veterans. They have amazing webinars and events that are specifically for women and minority veterans. And they also have lots of resources out there for unnaturalized veterans and such. The next thing is Calvet Home for long-term care. You're going to learn a little bit more about this later on with Paul. And then we have Calvet Cemeteries, which again, you're going to learn about that with Erica later on in our presentation. This is that resource book I was telling you about earlier about. Download that, or you can go to a county assessor's office. A county veteran service office and get one of those hard copies, or you can call us up to get one of those. Michael's going to put our phone number in the chat so you guys can give us a call if you want us to send you a Calvet resource book. Now, we want to continue to support you. The questions you have today, you may not have tomorrow, and vice versa goes on. We want to help. We want to be there for you. And we want to always get those resources and benefits to you. So if you guys provide your non-DoD email address to CalTAP at calvet.ca.gov, we can continue our relationship. We can give you updates on webinars. We can give you updates on presumptive diseases. We can give you updates on new benefits that are out there for you in the state of California and federal benefits that are out there. Or you can register for My Calvet on the Calvet's homepage. It was that right there on the right-hand side. Just click on that. It'll ask you a few questions about your demographics and the things and your needs. And then it will make the website personalized to you. So all the things that you're interested in are going to be on the Calvet's homepage, and you're going to be set up to get updates. We will not spam you. All of these things, we will not spam you. You will not get things that you don't need. You will not get random emails. We will not share your information. This is for Calvet resources and benefits. Next you could do is add us on our social medias, which I put some nice QR codes there, so you guys can just scan those bars to get to our different social medias. We really highly recommend. I'm going to stress this so much because all of our webinars are recorded and they're fantastic. You can go to our YouTube channel. All you do is go to YouTube and you put in the top search bar Calvet there and go to our channel, subscribe to that, and you'll get updates pretty much weekly on the different webinars that we've had. So you don't have to always sign up for something, or maybe you missed a webinar, you can't get to a webinar. These are recorded and you can access them at any point. Or let's say you find that this webinar is fantastic, you want to share it with friends, it's going to be on the YouTube. And then we ask you guys fill out today's surveys. The surveys we use every single day. We want to make our webinars and the content that we create, we want to benefit you guys. If there's stuff that you like, let us know. If there's stuff that you would like us to put out there and to do webinar on that we haven't done one on, let us know. If there's something that's overkill, let us know. We want to make these most beneficial to you guys. So this is va.gov. This is a fantastic resource that we want to point out that you guys can access to find out about disability claims, get your records here, healthcare here, find out about education benefits. It's a really great hub to find out about your federal benefits. This is my contact information. I went through quite a bit of information. This webinar is it's primarily for aging veterans and things like that. So it's going to specialize in different things. So if I was talking about something that you want to learn more about, give me a call, send me an email, and I will be happy to go through any and all benefits with you. With that, I'm going to hand the floor over to Annette Wallover. She is our local interagency network coordinator, the boots on the ground in the Central Valley area.
Hello, everyone. Yes, I am at Link, is what we're referred to. Actually what I am is I'm a field rep. I'm one of the 8 field reps for the state of California. Next slide, please. So on the map that's coming up, it's going to show you that Calvet has divided the state into 8 regions. Each color is a region with a coordinating link. I'm the Central Valley link covering Stanislaus to Kern counties, 8 counties representing about 144,000 veterans. But as links, we actually represent all military service members, current and prior military service members. We work together as a team to get those federal and state resources and benefits that we can provide to our military community. But then we work within our individual communities to ensure that we build up those additional resources. So we work with our collaboratives, we work with our nonprofits, so that if state and federal cannot handle the needs of our military population, we can reach out to them. Next slide, please. So we provide outreach to service members, veterans, and their families. We go to DoD installations. I'm in Lemoore Naval Air Station, probably once or twice a month, to assist military service members before they even separate about their benefits. I go to community colleges, veterans resource centers. These are typically recently separated veterans, so that they are aware of all the things that are available to them, as well as our libraries, which are in very remote locations, and their centers, so that they kind of provide a lifeline to those military service members out there. And then by working with our community partners, we can make referrals and work directly with established service provider networks. A good example of this, if somebody needs let's say their battery died in their car, or they need a bus pass. Actually, I had someone who said they had a hole in their roof, a veteran. And by reaching out to the community partners, within at least an hour, I had 15 people saying, okay, we can get somebody out there, or we can find someone to assist them. And then we assist with local emergencies. I was actually deployed to the local assistance center in Tulare County in Porterville for the SQF fire evacuees. And in some cases, these veterans not only lost their properties, but they lost all their paperwork. And that DD Form 214 is a valid piece, a very important piece of paperwork. Make sure you have a copy available or you can get to it. But by working with the County Veteran Service Office, we were able to get additional copies of the DD Form 214. And actually working with CalVet home loan agents, get certificates of eligibility if they wanted to go forward with a CalVet or a VA home loan. And if they had a CalVet home loan, assist them with their insurance paperwork. Currently, headquarters has calls going into, anytime you call 1-800-CalVet is fielded out to us agents. So whether I get a call from Klamath Falls or San Diego, because I know the state and federal agencies, I'm able to assist them. And if I need to get deeper into their community partners, I can call their link. And then we provide leadership and advocacy to local communities. And we do this by staying in touch with our community partners, making sure they're aware of the benefits and service, any updates or changes, but also if there's any gap in benefits that we can field up to headquarters. Next slide, please. So getting connected to your benefits, that's what our mission is all about, especially as us links. And I'm the poster child for getting connected to your benefits. I served in the United States Army from 1975 to 1978. I used my GI Bill, got my degree, got a VA home loan, and I thought that was pretty much it. And I didn't realize until 12 years ago, when I was unemployed for the first time ever, it seemed like, that I needed more help. So I went to the EDD office and I found out I'm a veteran. I didn't realize that. I used to say I was in the Army. I could file for compensation. So now I have a service-connected disability, which leads to additional benefits. And as Jen was saying earlier, your needs change over time. I didn't realize I could still enroll in VA healthcare. So I've been in VA healthcare since 2010. So these are the agencies we work with day in and day out. Employment and training, the Employment Development Department has dedicated staff that can assist veterans with whether it's resume preparation, interview skills, or just getting connected to employers. I was an EDD vet rep for 8 years, so I know how hard they work for our veterans. And they are co-located in the America's Job Center of California. California state benefits, of course, that's what CalVet is all about. And every state has different benefits and different eligibilities. But it's those county veteran service offices. These are the boots on the ground. There's 8 links in the state of California, but there's 56 CVSOs. So you can go to them to file for compensation and pension, college tuition fee waiver paperwork, DMV, parks. They're there for you to assist in any issues that you might have, and maybe just having a conversation with them can lead to additional benefits. Healthcare, we should always be mindful of our healthcare, especially during this time. I've been very fortunate. When COVID hit, everyone was closed down, but my medical benefits through the VA, I've had my appointments through telehealth and VA Connect. So you can enroll either online, or you can actually call and ask to speak to eligibility. So please take advantage of these benefits. Things don't expire in a lot of cases. So reach out and take advantage. Next slide, please. So this is my contact information. If you need any additional information, please reach out to me. I'd be more than happy to help you. I'm a United States Army veteran with a service-connected disability. I've used these resources so I can get you in touch with those people you need to. Thank you. Thank you for your service, and have a great day.
Thank you so much, Annette, for what you do for CalVet, everybody in the Central Valley area, and your presentation today. We really, really appreciate you. All right, with that, we're going to move on over to Paul Lindbergh. He is our he's our Veteran Service Officer in the Yountville home.
Okay, thank you, Jennifer. You can go to the next slide. Good morning, everybody. As Jen said, my name is Paul Lubkert. I am currently I work at the as the Veteran Service Officer at the Veterans Home of California in Yountville. There are 8 veterans homes, and I work at the one in Yountville. I've been here about 5 years. Prior to that, I spent 28.5 years in the United States Air Force. So I am retired. I was in aircraft maintenance there. But right now I'm a CalVet employee, but I am VA accredited. So I do most of my work remotely. I remote into a VA system to work my claims primarily. So I can, just like your county veteran service officer, I can cover any of the federal or state benefits, many of which Jen already went over, and several are listed on the right side of the slide here. But the bulk of my work is representing primarily the residents of the veterans home here in Yountville. I do help some employees file claims and occasionally some folks from the local community, but the bulk of my work is doing compensation and pension claims for the residents of the home here. Next slide. So this, like I said, comprises the bulk of what I do, filing claims for VA disability compensation and pension. These two programs get mixed up a lot, and there's occasionally some confusion between the two. So the basic difference is that both pay a monthly stipend. A veteran could qualify for both, and in fact could be awarded both, but the VA will only pay you one or the other, and by default they pay you whichever is the higher benefit. Disability compensation is for an injury in the service, so it has to be linked to your active duty. Some examples, combat injuries like PTSD, an injury in training, hearing loss, exposure to hazardous noise or hazardous waste. But any injury that is a current disability that we can link to your active service, you may be entitled to disability compensation. Pension, also a monthly benefit, but it's needs-based. So it's primarily for low-income veterans or veterans with high medical expense, because you can offset your income dollar for dollar with your medical expenses. You do have to have served not dishonorably, so above a dishonorable discharge, and you have to have served during a period of war to qualify. Slide. Okay, I'll go over here in the next couple of slides how you can find a veteran service officer like me or your county, and the link did a pretty good job of describing that too. You could simply Google county veteran services for whatever county you're in, and very likely your number and contact for your county is going to show up. Or you could use the CalVet website, which will be on the next slide, and then I'll briefly talk about how to file a claim. So again, if you don't know how to get to the CalVet website, you could Google CalVet and click on the first link. Slide. And at the top banner there, where it says find a service provider, if you just type your, that'll bring up this page here. If you just type in your zip code, go to the next slide, and I'll show you what happened for Yountville. I typed in the zip code here at Yountville, and it brought up, I chose a 50-mile radius. You can choose different distances depending on how far you want to travel. And it showed 3 within 50 miles. So it showed Napa County, Solano County, and Sonoma County. Great website, great. This is one of my favorite features of the Calvet website. So it'll list, like I said, all the service agencies in your area. Next. This is kind of a bit of an eye chart, so I'll just kind of go over the basics. The main point I want to get across is that if you do want to file a claim, or you do think you're going to have a claim for disability, for compensation or pension, or any other claim for that matter, it's very important that you get that intent to file form done, that you contact a VSO like we previously discussed, and get an intent to file in. And the way I explain this to a lot of our, for example, if a veteran moves into the home, just as a matter of course, we do an intent to file on day one, just in case there will be a future claim. And I explain it as like an insurance policy. That intent to file basically starts your date of claim, and it gives you a year to go through everything else on this slide, to gather the evidence, to get your service records, to get some current treatment records. Because again, you're going to need a current disability for compensation, and we're going to need to prove that it was related to the service. So sometimes it'll take us a few weeks, maybe even a couple of months to get those records. So that intent to file will solidify that date of claim. So even if it took you 11 months, you would still get paid back to the date you filed that intent to file. So please, you don't need to wait until you have everything to contact your veteran service officer to start that claims process. But once you do that, you do need to get, like I said, you need to gather the evidence. You're going to need medical records, probably from this service and from your current provider. You're going to want to see your VSO. Eventually, if you file a claim for compensation, you'll be sent to an exam, and then you just have to wait for the decision. Next. Okay, you can go to the next slide. I'll talk about some presumptive disabilities, and these are under compensation. So these are pretty big deals out here at the home, particularly Agent Orange. So a lot of the veterans that served in or near Vietnam and were exposed to Agent Orange, there are several diseases all listed here, where VA will presume if you have that disease and you had service in Vietnam, including the waters around Vietnam, it will be presumed that Agent Orange caused that particular disease, and you will be awarded compensation. Now, the only reason I highlighted the ones in red that I did is that in my population here at the Veterans Home, we see those a lot. I see the others less, but they all carry equal weight in terms of a claim. So if you served in Vietnam and you have heart disease or diabetes, or you've had prostate cancer, et cetera, you definitely are likely entitled to some compensation, and you're going to want to see your veteran service officer. Next slide. Recent ads, it's been a couple years now, but in 21, they added a couple of new presumptive conditions for Agent Orange exposure, and those were bladder cancer, hypothyroid, and Parkinsonism, excuse me. Next. So for folks that served at Camp Lejeune on active duty, any veteran that has these conditions, they will be presumed to have been caused by contaminated water at Camp Lejeune. And there's some carryover with the Agent Orange, but there's also some differences. So if you did serve at Camp Lejeune and you have some medical conditions, they could possibly lead to disability compensation for those conditions. Next slide. So the previous slide was for the active duty for the veterans, the family members that served, their dependents. For example, like Jennifer, had she served at had her family served at Camp Lejeune when she was a kid between those dates, 53 and 87, and she were to come down with any of these, or her spouse or something, they also can receive VA health care for those conditions. So that's a great benefit for the family members of those veterans, again, due to tainted water at Camp Lejeune. Next slide. Okay, next. So VA compensation, just a quick slide. When you get an award for a disability under compensation, they score it. Each disability that is awarded that is service connected ranges from 0% to 100%, depending on the severity. 0% is an actual rating, but it would be non-monetary. So for example, I served in the Air Force for a very long time. I worked on airplanes. I don't hear so well, but my hearing loss is actually rated at 0% because it's not determined by the VA to be bad enough to give me any money, which is fine. But for example, my tinnitus, which is the ringing in the ears, often associated with hearing loss, is 10%. So I get currently $152 for the tinnitus if that were my only disability. I have a couple others, but so there's a range from 0 to 100, and then they combine. If you have multiple disabilities, they combine your ratings. And I didn't list them all here just because space constraints on the slide, and I didn't want to overwhelm you. But I do have those numbers if y'all need some specifics. But they range from 0 to currently 100% would get you a little over $3,300 a month. Special monthly compensation is additional money in addition to those ratings for things like loss of use of maybe an arm or an organ. If a veteran is housebound due to a service-connected disability, you could get some extra money. And aid and attendance, which is very common for pension, is also available, although a little more complicated with compensation. Next slide. Okay, so you can go next. The non-service connected pension, remember, pension is what I was telling you was needs-based. So it's primarily for aged or disabled. So over 65, you qualify based on that. If you're younger than 65, you have to be disabled. So normally, like if you're receiving disability from Social Security, that's a pretty good barometer that you would qualify for a VA pension. You have to have served for 24 months. With at least 90 days during a period of war, or the full period to which you were called to active duty if you're in the Guard or Reserve. And that minimum 24-month doesn't apply to everybody, particularly if you were injured in the service or if you served prior to 7 September of 1980. Next slide. Again, pension is needs-based. So there's a whole bunch of factors, but it basically comes down to income minus medical expenses. So I didn't put all the numbers on there, but I do have those. So the low income for the examples of this slide, this would be a single veteran with no dependents that does not qualify for A&A. His or her income limit would be $14,753. If that same veteran did qualify, that's a little over $1,200 a month, $1,229. If that same veteran did qualify for aid and attendance, it would be, if that same veteran still didn't qualify for aid and attendance, but had one dependent, that number would go up to $19,320. So it'd go up to a little over $1,600. So it's about a difference of about a little less than $400 a month for that veteran. Again, this isn't counting aid and attendance. That's just your basic pension. It's mainly just a math drill once you qualify. VA counts all income. So for example, if a veteran is married, they're going to count the veteran's income from all sources. And they're going to count the spouse's income as well. But medical expenses like nursing home fees, for sure, co-pays for prescription medicines, if you're paying health insurance, many things qualify as a medical expense. So you can write off just because you see those numbers that seem low sometimes in terms of your overall income. We can often write that down. There are net worth limiters as well to pension. Currently, there's a little over $38,000. That's not including your primary residence. But if you do have other assets, cash in a bank, stocks, bonds, IRAs, etc., there is a net worth limiter imposed on the pension. And these limits are increased each year. The numbers on these slides are all current as of 1 December 21, and they'll be adjusted again this year in December. Next slide. Next. Okay, so aid and attendance is an additional, I'm talking about the pension piece here. You can get, a veteran could get up to an additional $821 if they required the aid and assistance of another person, really for their activities of daily living. These can be awarded for a host of reasons. It's basically a medical determination, but if someone is blind or nearly blind, if they need the aid of another person to help them dress or ambulate or feed themselves, if they're a patient in a nursing home, all those folks would qualify for aid and attendance. But you do need medical evidence, and of course, VA has a form for that purpose to help with that. Next slide. Okay, so there were two, I saw at least two questions in the chat about survivors benefits. Hopefully I'll cover your questions here, but if I don't, you can ask me later. So survivors pension and DIC, they are for surviving spouses. The pension is very similar to the veterans pension. It's for low income surviving spouses in this case. Again, it counts all income. That same bright line net worth limiter applies, but the income threshold is quite a bit lower, currently $9,896 for a surviving spouse. DIC stands for dependency and indemnity compensation. So you don't need to remember that, but it's basically the compensation side of a survivor's benefit, and it pays a higher rate, and it's paid to the spouse of a veteran who died from a service-connected condition. So, for example, if a Vietnam veteran was service-connected for his Agent Orange-related heart disease, and he or she died of that, his or her spouse would be entitled, could be entitled to DIC, which is currently pays a little higher than survivor's pension. It's can be as high as $14.37 a month, and they can get ANA. Spouse's ANA is slightly lower than a veteran's ANA, but there's the numbers for ANA, and HB means housebound, which is a similar bump in the pension or DIC. Next slide. Okay, next. This kind of relates to if you're applying for VA healthcare or any sort of VA benefit and you just need to know where to go to get your DD-214. Most people already know this, but you can go, if you just Googled NPRC, that stands for National Personnel Records Center. The National Archives website will come up. You click right there to get your DD-214. You can also request your military files. You can get replacement medals here. All those stuffs are available right here through that website. Pretty convenient, so I just wanted to put that up there in case you hadn't seen that before. Next. So VA healthcare, again, you may need that DD-214. We will need that DD-214 to enroll in VA healthcare. Here, some of the qualifiers, you have to have served 24 months or for the full period if you were called to active duty. And again, same deal as with the pension. Some of those minimum duty requirements may not be as strict if you served prior to 1980, or if you were injured while on active duty, or discharged for a hardship. Next. Oh, excuse me. Enrolling in VA healthcare, they try to make it as easy as possible. You can do it by phone. You can do it in person at you go to a local VA healthcare facility. You can enroll there. You can do it online. Next. So Jen showed this page earlier. You click right on the VA front page, apply for VA healthcare right there in the upper sort of left quadrant. You will need your DD-214. You're going to need income information, social security numbers, account numbers for any current health insurance. And in addition to the phone and online and at the VA website, there is a form for this too that you can mail in if you still just prefer doing it that way. That form is a 1010-EZ. Next. All right. So like I said, I'd like to thank Jen and everyone Jen for inviting me, and everyone else for coming today. Just let me read these questions real quick about the spouse. Are there any resources available for elderly spouses? So there are some resources available for spouses. If you have specific questions, ask me, but I would certainly contact your local county veteran service officer about that. And then Bob asked a question that his spouse is currently in a memory care unit. Do my VA benefits help with this expense? So they do, particularly if Bob were a veteran applying for pension. His spouse's medical expenses are just like his medical expenses. So particularly with pension, when I said they consider all income from all sources, they also consider all the medical expenses of the family. So primarily the demographics I deal with are the veteran and the spouse. But for younger veterans, if they have children that maybe have massive medical expenses, you can write all that stuff off. So I would certainly encourage you to contact your county veteran service officer, Bob. Give me a call if you have specific questions about that. But there are a multitude of benefits available for our spouses and surviving children. That's it. Thanks, Jen.
Thank you so much, Paul, for everything that you do for for dependents and the veterans and everybody at the Yountville home. And thank you for what an amazing, really, really good, informative presentation. Thank you so much.
Thanks.
All right. With that, we're going to move on to our next presenter, Erica Cheney. She is our staff service manager for Calvet Cemeteries. Are you there, Erica?
Hi everyone, I am here. I have been having challenges this morning with my Zoom with my video. So I apologize. My screen is not on the face. It was a minute ago and then it disappeared again. So I'll go ahead and get started. But yes, my name is Erica Cheney. I'm the Staff Services Manager 1 for the California Central Coast Veterans Cemetery in Seaside, California. This is the Calvet website, and to find information about cemetery and burial benefits, you would go up to that Calvet programs link on the Veterans Services, and then that would bring you to the cemeteries and burials link. Next slide. Yes, so this is the cemeteries and burials. If you click the state cemeteries, that will bring you just to the 3 veteran cemeteries that Calvet runs. There's also a link for national cemeteries. There's a more thorough link to burial benefits. Also, both of the pre-need applications, whether you choose a state of California veteran cemetery or a national veteran cemetery, which of course is part of the federal VA under the National Cemetery Administration. Next slide. So in general, eligibility for burial benefits is the veteran would have either died on active duty, another way served on active duty and was discharged under conditions other than dishonorable. So in general had an honorable discharge. Also, spouses of an eligible veteran are eligible. The difference at state of California veteran cemeteries is we do charge a fee for the interment of a spouse or minor child of a veteran. And then as far as who can be buried first, it doesn't matter. So if the veteran died first, we can do the interment for the veteran. If the spouse dies first, we can do the interment for the spouse. And then again, in some cases, the unmarried adult dependent child of a veteran is eligible to be interred at a state of California veteran cemetery. However, that's usually a medical dependency before the age of 21 or 23, I believe it is, if they were in school. And that would have to be documented with a doctor's note and some other documentation. So those are more rare situations when an adult dependent child is eligible for one of the state veteran cemeteries. Next slide. So as far as what burial benefits, what's included, a burial and the plot, of course, or a columbarium niche, which is the structures outside, these very large granite structures with several rows and columns. And the niche itself measures about 14 inches wide, 10 inches high, and I believe it's 18 inches deep. Your benefits also include a headstone or marker. And the VA itself will furnish, upon request, at no charge to the applicant, a government headstone or marker for the unmarked grave of any deceased eligible veteran in any cemetery around the world. So regardless of their date of death. So that means if you don't choose a state of California veteran cemetery or even a national veteran cemetery, you can request as part of your benefits a VA headstone, say at a private cemetery. Some of the types of headstones and markers that are available through the calvet cemeteries include the upright granite headstones. And those are, of course, are for caskets or cremated remains that are buried in the ground. That's an option as well. Granite niche covers are what covers the columbarium niche. And those, of course, are only for cremated remains. And then a memorial marker is for essentially when there's no remains or cremated remains available, such as perhaps the family wanted to scatter the ashes at sea, or if they want to keep the ashes, then we can do a memorial wall plaque. It's much smaller, but we have a designated area for those too. Next slide. So a little bit about the Military Funeral Honors Program, which is quite special. The military of each branch will send typically 2 or more service members on the day of a service for a veteran to whatever cemetery will request it. Or if you don't, if you're not interring or burying the veteran or eligible spouse at a state or national veteran cemetery, you can also call, and we can probably post a link for how to request military honors at perhaps a church or a park or wherever you're having a memorial service. They'll essentially go anywhere. But what it includes is folding and presentation of a U.S. flag to whatever family member wants to be the recipient. They'll play taps, and then a gun salute or a rifle squad. That's usually reserved when it's a military retiree. So 20 plus years in service is when they'll try to arrange that, just because it takes more of them. And of course, any service members killed on active duty or medal honor recipients, there may be a couple other scenarios that they would arrange for a 21 gun salute. Next slide. So I mentioned that there's 3 primary, only 3 state veteran cemeteries in California. The one I'm the director of is California Central Coast Veteran Cemetery in Seaside, that's Monterey County. Then of course there's the Northern California Veteran Cemetery in Idaho.
Are you there, Erica? Let's give her a second here. She might have some technical issues. I can also continue her slides for her until she gets back on. I guess we'll do it that way. Give me 1 second. Let me get it. All right, there we go. All right. Sorry about that delay. There's also some national cemeteries in the state of California. We have the Bakersfield National Cemetery. We have Miramar, Riverside National Cemetery, Sacramento Valley, and San Joaquin. You can find out more about each one of these cemeteries, where they're at exactly, and get a hold of anybody in those national cemeteries by going to our website. Go to Calvet programs. Underneath that, go to Calvet Cemeteries and Burials, and you can get the information there. So pre-need eligibility, this is a really, really cool opportunity for everybody. The pre-need eligibility offers both state and offered for state and national cemeteries. So what you do is you fill in all the paperwork that you would need for your VA burial benefits, and then fill that out with your DD form 214. And then you would give that to the cemetery that you would like to apply for. And you also have to attach a copy of your marriage certificate if a spouse is going to be buried with you, and the death certificates. So you send in all that information, give it to the cemetery that you want to go to. And if something were to happen, all that your loved ones need to know is which cemetery you have chosen. And they can go there, and they don't have to worry about any of the paperwork needed to have your burial. Erica, are you back yet?
I'm back.
Okay, great. I'll let you finish up there. Sorry.
Oh, did you do the last couple slides?
I did the last couple ones for you about national cemeteries and pre-need eligibility.
Okay, good. Yes. Thank you, you all. I'm so sorry. It just keeps kicking me out. But yeah, you can call and get the application. We can email it or mail it to you, or you can find it online on the website. And if you have any questions or just want to, talk about future planning, please feel free to call us. You can call the California Central Coast Veteran Cemetery. Our number is 831-393-9371. Again, my name's Erica, but anyone who answers the phone can help you.
Thank you so much, Erica, for all that information. That is really great information and very beneficial to so many people, whether it is the veterans themselves or the family members, or maybe you know a veteran. So we really appreciate all that information. Thank you for being here in your presentation.
Yes, of course.
All right, with that, we're concluding our presentation, but we definitely do have some Q&A questions. So I'm going to hand the floor over to Michael, who's been filling those Q&As and has been in the chat. Michael, are you there?
Yes, I'm there. Can you hear me?
Yes, sir.
All right, so we're going to go over a few questions here that weren't answered earlier. We got about 8 minutes here, so we're going to get through as many of these as we can, and hopefully we can get through these together. So the first question is on here. It says, is there a referral to a pre-planning at Forest Lawn or Rose Hills? Honestly, I'm not quite sure what that means, so I don't know if Paul could elaborate a little bit more on that, or if you guys know that by any chance.
So pre-need eligibility is for national cemeteries and state veteran cemeteries. So you'd have to actually, if it's a private cemetery, you'd have to actually go there and see what the pre-need eligibility is to get the paperwork started there. I think that's what the question was. I hope I answered that.
Okay, the next one here is for car registration waiver. Does the mobility issue have to be 100%, or can you be 100% total, but the mobility issues are not 100% by themselves?
That's a fantastic question. It is, to my knowledge, it's 100%, but I would actually go to a county veteran service office and actually ask if there's any waivers or any type of way to go around that, because you're missing a leg or if you're wheelchair bound, and there might be something else out there. I'm not quite sure, but I would definitely ask more about that with the county veteran service office, ask more about that maybe with your doctor, or ask more about that with your DMV.
Okay, so the next one here is how can somebody find out more information about Medicare benefits and Medicare Part A, and just more information about that?
So we have a fantastic contact at CalVet that it can explain, VA healthcare versus all the other plans out there. We can put that in the chat. That contact would be, I'm drawing a blank right now, but send me, whoever asked that question, send me an email and I will send you the contact information for that individual. I'm drawing a blank of his name right now, but Annette, do you know who that contact, who they should contact? Do you have a better idea?
I do not know, but also going back to the other question, I know the CVSOs had a conference last week there could be a lot of updates that they can bring forward. So I always tell people, go to your CVSO. Things change over time, and things are not static. So definitely talk to them, whether it's a disability rating, any paperwork that you need. We're finding out new information all the time. I know DMV has had conversations with the CVSOs, so make sure you get in touch with them.
Absolutely. That's great advice. All right. So next question.
Okay, the next question here is what determines your burial place?
Nothing. You can choose any burial site that you want to.
Actually, can I speak up?
Yes. Sorry.
So neither at state or national veteran cemeteries, do you choose your burial site? It's just the next one available. Yeah, so we definitely, we can't reserve spots or anything. So your pre-need eligibility just establishes eligibility. And then when your time of need comes, whether you choose in-ground cremated urns or casket or cone burial wall, it's just the next available spot in that section. Thank you.
Yes. Thank you.
All right, the next question here, is it true that I need to purchase a casket, open and closing for burial?
So purchase of a casket is not covered under benefits. However, I believe there's some kind of monetary benefit from the VA for burial, but don't quote me, but I think it's up to maybe $300. But the state of California, CalVet, does not pay for any casket or urn, or we don't do the cremation or anything like that. It's just for services at the cemetery.
Okay, and the next one here is how would you be able to find a VA rep for Forest Lawn and Rose Hills? I don't know if that would be the County Veteran Service Office or not, or if that's like a different area. Do you know, Jennifer?
I believe that's a private cemetery, so I do not have information about that.
Okay.
Now, if it is a national cemetery, I would have them call the number for the National Scheduling Office or the National Cemetery Administration and speak to them directly.
Okay, so for state job applications, is there a person at CalTAP that can help guide me through the process?
So I can definitely, if you want to send me an email, I can definitely walk you through the process and the different tricks of the trade to get get that started and start applying. So I could definitely do that for you. You can privately message me in the chat, or you can email me, and I will 100% give you a call and we can walk through it together.
Okay. The next question here is, I have PTSD 70% and 2 other disabilities, which gives me a total of 80%. I'm interested in trying to get PTSD service dog. Could CalVet help?
CalVet doesn't have a division for that, but I would recommend going to va.gov, and on the right-hand corner, there is a search bar. Just put service dogs there. There is an organization, and you could find, you could contact our Bay Area link, Kevin Graves. He definitely has experience in this type of thing. His email, and if you could type it in there, Michael, for me, his email is kevin.graves@calvet.ca.gov. So he might be able to help you navigate that and find organizations that do assist with that. Or you can also go to va.gov and in the search bar, put service dogs.
Okay, the next question here is the cemetery and burial benefit covered partially or 100%?
So burial benefits are fully covered, again, for services that happen at the cemetery. So for a veteran, there's absolutely no cost for burial and perpetual maintenance of the gravesite. For the spouse, the state veteran cemeteries through CalVet do charge a fee. Right now, that fee is $828. However, you cannot pay it in advance. It's only paid on the day of service or burial. And then every year it typically changes. It typically goes up $10 to $20. And that's based on some, it's based on the price that the VA sets as well. The national cemeteries, also the veteran it's part of their benefits. There's no charge. And I do believe, if nothing has changed, that they do not charge for spouse burial.
Okay, well, thank you very much, guys. I'm gonna end this right here. It's 11 o'clock, so we're about out of time right here. So if you didn't get your question answered, you can either call us or you can email us. And also, please don't forget to fill out our survey. And I'm gonna give it back to Jennifer real quick, and we're gonna close it out.
Thank you so much. Thank you to all of our presenters, and thank you to all of our participants that are here with us today. We really appreciate you guys. Thank you for your service. Please spread the word about this webinar and all of our webinars. And please to follow this QR code and let us know how we're doing. Let us how we can improve. Let us know what's working, what's not working, because we definitely want to serve you guys and put out fantastic products that are very useful to you and your family members. So thank you so much. Here is some upcoming webinars that you guys might want to attend: emergency preparedness, disaster assistance resources, and emergency preparedness 2. So these are for those fire disasters, floods, things like that, ways that CalVet can help you in those time of need. And the last here is slide here is our contact information, our email, and also our website, and QR codes to our social medias. Check out our YouTube channel. Very, very helpful. Thank you so much. And you guys have a fantastic day. Bye-bye.